And he's waited very patiently for us, but last but certainly not least, Paul Moulton from Isle of Man Television. Good afternoon, Paul.
Good afternoon, Mr. Ashford. Like other people, we're hearing things and it was going a bit wobbly, but did I hear you're looking for volunteers, and that those volunteers will be the ones that will be making these injections? Can you just clarify exactly what was said there?
Right. So it's medical professionals, Paul, to be absolutely clear. We're not looking for general members of the public to come forward and say, yes, I'll vaccinate someone. It's retired GPs, retired nurses who already have the appropriate training, who then undergo a short training course on how to deliver the vaccine. We will be using our own health and care staff, of course, but basically it's all hands to the pump, Paul. This is the biggest vaccination programme that has basically been seen in human history. And if there are people out there with appropriate qualifications who wish to volunteer to help, then we'd be more than happy to hear from them. I'm delighted to say there's a lot of people that have already come forward. In fact, I think I've fielded 3 today of a retired GP and 2 retired nurses who've contacted me saying they're happy to help. And let's get it done as a community.
In all your tabletop exercises, surely this would be one that you would see coming. So this could have been done months ago to get everyone up and running, ready for the big day, right?
Well, again, Paul, we've got to say this isn't going to be completely instant. This is a programme that is going to be spread out across quite a period of time. So I need to be quite clear on that, because we need the supplies of the vaccine coming in. We need the logistics around delivering it. So it's not just a case of having a load of people in place and suddenly everything's going to be delivered in a month. That's not the case. This is, this is a marathon, not a sprint in terms of delivering a vaccine. And I need to get that message across again. All we are saying is if there are retired professionals out there and they wish to assist, we would be happy to hear from them. We've been hearing from several people for months now who've come forward and offered their services, for which we're very grateful.
Well, obviously, clearly you've thought about how people are going to be notified. So can you share with us, is it going to be a text? Will we be getting letters? I mean, everything's in place for that, right? You've done that part of the organisation ready for the vaccine, I'm guessing.
Yes, yeah, and I'll bring Catherine in to explain a bit more around that. Oh, sorry, Catherine. Yeah, we can hear you now.
Thank you. Yeah. So yes, we have pretty much developed the booking processes. We actually expect those to be ready by the middle to the end of next week, which includes all the IT development that's gone with it. Initially, yes, individuals, according to the groups and those JCVI policy groups, priority groups that you've seen and been well publicised, will be invited. We'll be asking people to phone their to phone 111, and then they'll be booked in from there. So that's how we manage it. That's how we manage the front end, and then there's a lot of administration that goes on at the back end in relation to how we record the vaccine that they've had, and also how that's put on their GP record. So similarly, the processes are underway to manage that as well. So it's quite an extensive piece of work. And with reference to your question earlier, yes, we have been planning for a great number of this for a number of weeks now. Actually, the information has only really just started to come through. So, for example, as we sit here at the moment, we're still waiting for the final training package in relation to the actual COVID vaccine itself. So we are expecting that shortly. So it's actually at the right time now to put that call out for help. And as I've suggested earlier, we're looking for people to contact lead at gov.im or to telephone 685 714 716. That's 685 716, and healthcare professionals who are willing to help.
Just to be clear, people will have to ring in to get on the list. You haven't got the database and you'll just be calling us up as and when, because you must know exactly who are the oldest people out there who needs it first. You must have that. But you are actually saying people will need to ring in to get a booking if they fit the right criteria when you announce it.
That is correct, yes. The booking process will be done through 111, but they'll be invited by their GP according to the age groups, very similar to what we do now in relation to flu vaccinations. But yes, they will be asked to book via the 1-1 system, and we'll ask people to call in.
So
yes.
Paul, just to give you absolute clarity, Paul, there, so there's no confusion, people will be invited to come for their jabs. So they will be contacted, and then basically they will be told to ring 111 to book the appointment to have the jab. Hopefully that makes it a bit clearer for you as to how the process will work.
It clears up a lot. Otherwise, I was going to ask you, you're going to be swamped otherwise on 111, weren't you, for people wanting to get in the queue?
No, so hopefully that makes it clear. They will receive an invite, contact first, list to say they're within the category, and then they will book the appointment to actually go and have the jab via 111.
Right. As I'm last, do you mind if I have a quick last one?
No, I'm going to let anyone else who's got additional questions have them as well.
There potentially could be 3 vaccines available. Now, we clearly hear this one's pretty difficult to deal with, and there's all sorts of implications. But the 2 others that are coming through potentially could be licensed any day now. Therefore, the question is, will people get the choice to pick which one they want, or will they be told this is the one you're getting?
No, it won't be a choice, Paul, as to which one you get. We will be delivering a mix of vaccines across the programme. We do not have the ability, same as the UK, for people to pick and choose which particular vaccine they would prefer. In terms of the Oxford one, you're quite correct. It is a lot easier to handle. It's a lot more mobile. It's stored at regular fridge temperature. So we will be seeing, and the higher numbers as well of the Oxford vaccine. So we have to remember we've got to use the tools at our disposal. So no, it won't be a pick and choose.
Thank you, and we'll see you Monday for our usual chat.
You will indeed. We'll have our usual chat on Monday.